Welcome to Grow with Amanda.
How did Benjamin Franklin feel after discovering electricity? He felt shocked.
Today, I want to talk to you guys about something that has had such a big impact on my life, and I didn't realize how big of an impact it would have. I thought I would educate people about this subject because it's a very controversial and not very common thing that people know about or talk about. And so what it is ECT, Electro Convulsion Therapy. And basically what it is they're causing a seizure in your brain in order to help try and rewire it, because when you have a seizure, your brain likes to rewire itself. That's basically a very summed up version. So if you've never heard about ECT and you have absolutely no clue what it is, I'm going to give you a little bit of a backstory of how it started and what the process of ECT is. It started off being called electroshock therapy. It was introduced around 1930s, around that time, except it was even more controversial back then because when you had ECT done, or electroshock therapy done, a big majority of people ended up with broken bones or other related injuries because they didn't have muscle relaxants. So they weren't able to relax your body while they were doing this. It was just like, let's put you to sleep and let's shock you, see what happens. It's gotten a lot more advanced nowadays. So what happens is they bring you into a room, they put you under general anesthesia, and they also give you muscle relaxants. So although you are having a seizure, you're not going to be like convulsing like somebody who would be awake and having a seizure. You're actually going to be completely still. Sometimes the doctors will put either on your wrist or on your ankle a little band to keep the medication from going to that area so they can see you twitching. Otherwise, they'll just monitor it on the screen. It really just depends on where you're getting it done. And once they put you under, they either connect you unilaterally or bilaterally. So unilaterally is they'll attach on the top of your head and on the right side of your temple, and this basically only affects the right side of your brain, but bilaterally they're attaching it to either side of your head. It just depends on what you need it for and what area of the brain they're trying to target. It basically sends a little current of electricity into your brain. It's basically a millisecond of an electric shock that gets sent into your brain, and that basically creates a seizure. The seizure lasts typically 30 to 60 seconds. Sometimes it can last longer. If that's the case, they do have medication to stop the seizure. And then once you're done your seizure and they've finished the procedure on you, you basically go into the recovery room, they wake you up with some medication, and you're totally fine. There are some side effects associated with it, and I'm going to list off a couple of them. Now, everybody experiences this very differently, so although one of the side effects is muscle aches, it can be very different for people, and depending on what stage of the process you're in, it can also be very difficult. After my second treatment, I ended up being in bed and I wanted to give up. I didn't want to go back and have it done because it honestly felt like I was hit by a 2-ton truck. I was in so much pain, I barely could get up out of bed. It was brutal, but I knew that I really wanted this and I had to commit to it, and so I just pushed through. And after about the third, fourth time, I didn't have that feeling of feeling like I was hit by a 2-ton truck. My body just wasn't as sore after the fact because I guess I got used to it a bit. With ECT, there's a lot less side effects than there is with medication, but there are some pretty significant ones. So right after your procedure is done, there's a couple side effects that you might be experiencing. Drowsiness, a little bit of some confusion, especially right when you wake up from the procedure. You're kind of like, oh my gosh, what happened? Where am I? But the nurses, at least the nurses I had, were very well with it and helped me kind of come to and realize where I was. You might experience some headaches, maybe some nausea, muscle aches, like I said, and loss of appetite can actually be associated with it right after your procedure. Some long-term effects that might be associated with it is difficulty concentrating, difficulty learning new things, and memory issues. And the reason the two prior to memory issues is an issue is because of the memory. You really do struggle with your memory after. That's why a lot of the time I have such a hard time just remembering things or being able to, for example, completely memorize a Shakespeare monologue. I used to be able to do that no problem in high school and college. Absolutely no problem. But once I got this procedure done, I can't even memorize a paragraph by myself. And I have worked for months on my memory. I have spent countless hours working on it with my therapist, by myself, using games, and it truly does take a significant amount of work to get your memory back to where you want it to be. I don't think that your memory will ever go back to where it was prior to your procedure, but I definitely think that you can get pretty damn close, because it's just all about how much you're willing to work on it. Like I said, I've worked hours on it. I've put so much time and effort into getting my memory back to where it is at this point, and it's still not perfect, but it's a lot better than it was before. Kind of give you an example, I would be sitting there and someone would be having a conversation with me and my train of thought would just leave the station. It wouldn't come back, and I would be mid-sentence, and that's basically what would happen. Mid-sentence, train of thought, gone, cannot remember what's going on. And it would be very unpredictable. It was very frustrating as well because people didn't warn me. They did say that I might experience memory loss, but they didn't tell me the significance of the memory loss. And so I really want to preface that if you're looking into ECT, please be prepared that after the fact, you're going to have to work on your memory. I haven't met a single person who's done ECT who hasn't had to work on their memory. And that's why ECT has had such a big impact on me, because of my memory. So basically, you're going to do this for roughly 3 to 6 weeks, and you're going to have 8 to 12 sessions. Some people also require monthly maintenance after the fact, especially if you don't want to go on medication after. But the success rate for ECT is unbelievable. 70 to 90% of people who have ECT recover from whatever they're getting ECT from. It generally helps, versus 50 to 60% of people who are successful with medications. So that's why I personally switched to ECT and stopped attempting medications at that time. Now, in order to get ECT done, there's a huge criteria list that you have to do, a bunch of tests you have to do. But some of the main ones are you have to have tried at least 3 medications prior to. You also need 2 psychiatrists to approve of this, which we all know getting in to see a psychiatrist can take a long time. So that's why ECT is kind of a long process to get to. But it can be very, very beneficial for people who are suicidal, who are in a catatonic state, or who are in psychosis. This is why for me it worked very well, because I was in a state of psychosis. I truly don't believe that I would have gotten out of that as easily as I did if it wasn't for ECT. It truly helped me, and although I went into it thinking, oh, there's memory loss, let's get rid of some of these horrible memories I have, because I was going through a really rough breakup at that point, and I was just like, let's get rid of these memories. It doesn't work like that. You don't get to pick and choose what memories you lose and what memories you keep. And I had already been doing my research about ECT right after I was diagnosed with bipolar disorder in August of 2018, because I was done medications. I had tried it since grade 10, and I was so sick and tired of different medications and all the side effects associated with it that I started looking into alternative methods of treatment. And that's when I stumbled upon ECT. I brought it up to my psychiatrist. He approved of it. We then moved on and sent me to another psychiatrist. It took way too long for me to get to that psychiatrist. I ended up in the hospital in the meantime, and that's when I got to ask the psychiatrist that I had been assigned in the hospital if I could do it. He approved it, and the process kind of started there. Once I had been approved officially and we had put me on the schedule and I was ready to go, I experienced my first one. I didn't have a seizure because you're not always guaranteed to have a seizure right away. So my first treatment, I didn't have a seizure. My second treatment, I did. I remember waking up, again, super sore. Didn't really experience very much side effects aside from being tired and a little bit of some loss of appetite. But other than that, I felt fine. I was honestly pretty excited. I was a little terrified because I was so sore and I didn't want to experience that again, but I was okay. After that, I kept going, and the reason that I stopped, I honestly think I would have continued and not went on medication if it wasn't for this pretty significant thing that happened. It was probably about 12 sessions in. I basically, when I went under, they didn't put me under enough, or I was built up a tolerance to the medication. Not really sure what happened, but I remember being there. I was not able to move. I felt like I was squeezing the nurse's hand, because she always held my hand when I went under, because I was always a little nervous. But I remember thinking I was squeezing her hand, but I was laying there, I couldn't talk, my eyes were closed, and I felt paralyzed, but I could hear everything that was going around me. I heard, okay, let's connect her up. And I was thinking in my head, oh my God, if I'm awake for this, I'm going to be awake for a seizure and they're going to have no clue. I was downright terrified. And I remember squeezing her hand, at least I thought I was squeezing her hand. And next thing you know, I'm waking up. But that was the most terrifying experience. So after that, when I went in for my 13th treatment, I had a full panic attack before going in. The nurse said to calm me down. You're not allowed any medication prior to going to have this treatment. So I wasn't allowed my anxiety meds. So I was losing it. And I didn't have very many coping mechanisms at that point. So truly, I was a complete mess. And after that one, I went for 2 more. And by the second one after that, I was like, I'm done. I'm not doing this anymore. Let's try something else. And that's when I was put on lithium. You can't have lithium while you're doing ECT. Lithium actually helps to suppress seizures. So when you're on those type of medications, you're not going to be able to have a seizure, and therefore the treatment's not going to work for you. I definitely think that ECT was exactly what I needed in that moment. I would recommend it to people who are having a hard time finding meds that really work for them. It really does work for people who are immune or aren't able to find the proper medications for them. It can be used to treat bipolar disorder, major depression disorder, and schizophrenia. It can also be used for dementia. There was a patient there that was with me in the psych ward, and she started experiencing some pretty heavy dementia symptoms, and one of them was being very aggressive. She was hospitalized because of it. We met there. She ended up getting treatment at the same time that I did. I saw her on my second last treatment, and she truly seemed like a completely different person. She wasn't aggressive, super friendly. She could hold a conversation. It worked miracles on her. So in other words, if I end up getting dementia, I would like to go on ECT again. So ECT isn't as scary as it might seem. I know it seems weird that you're voluntarily going in to have a seizure. I'm hoping that you guys kind of understand a little bit more about what ECT is and some of the benefits, but also some of the side effects that are associated with it. I'm so happy that I'm sharing this information with you guys, and that I've had quite a few people message me already saying that my previous videos has helped, so I'm hoping this one helps at least 1 or 2 people. Remember, hit that subscribe button, turn on your notifications, and get ready to grow with Amanda. Anesthetic, anesthesia, anesthetic or anesthesia? Is it called anesthetic or anesthesia? Really? So, just erase that, Amanda. Don't use any of that. Okay. What do you mean you don't know?
When they put you under?
Yeah, what's it called?
Okay.
Memory loss. It's a thing. It's a thing. Whew. I'm Amanda. Something that has had such an impact. Slow down on your talking, Amanda.
Anesthesia.
Anesthesia. Okay, thanks. Electrical current. Okay. So there are quite a few things associated with Was I just supposed to say bipolar disorder? No. We're talking about ECT. We're talking about ECT.